Aloha Kauai. Here's our daily COVID-19 briefing from Team Kauai for Thursday, April 23rd. The number of total confirmed cases still remains at 21. Of those 21 cases, 20 individuals have now recovered or returned to their home on the mainland. The remaining one active case is in isolation at the hospital. All but one case has been confirmed to be travel-related. Kauai's tally of cases and other information on COVID-19 can be found at the Kauai Emergency Management Agency or KEMA site at www.kauai.gov/COVID-19. To view the total number of positive cases across the state, please visit hawaiicovid19.com. The daily count on this site is updated at noon every day. We've had a few questions recently related to our testing protocols. How do we test? Where do we test? And if we can or should open new testing sites. The testing protocols for COVID-19 have changed over time, and that ever-changing environment can create confusion. So let's try to simplify it. In the early days of the crisis, there were few tests available nationwide. So tests were only offered to those who met strict federal requirements. And testing was initially only provided by government laboratories. However, over the course of the past several weeks, there have been increased testing capacity as well as more kinds of tests. One of the major changes that has increased our testing capacity is the addition of commercial lab testing. That said, with so many different tests being offered, some of the tests may not have the consistent quality of results that we require. The good news is the highest quality testing is readily available here on Kauai. And while some have shared concerns that our current testing sites are beyond their capacity, that's simply not true. We have several testing sites here on Kauai that are open to the public and ready to assist you. And yes, while testing in Hawaii was originally very tightly controlled and focused on those at highest risk, those strict restrictions are no longer in place. So, what does this mean for you? As it stands today, your healthcare provider can order a test if it's advisable for you. Most healthcare providers can determine over the phone whether you need to be tested. And if your doctor's office does not collect the actual sample, your sample can be taken at another medical facility. Here are some options on where you have your sample collected for testing. The West Kauai Medical Center, KVMH in Waimea, now has drive-through testing facility open from 10 a.m. to 2 p.m., Monday through Friday. You enter the KVMH Emergency Department driveway located off Waimea Canyon Road, and you will see the tents at the back of the hospital. Wilcox Hospital in Lihue is continuing its collection site, which is open from 8 a.m. to 5 p.m., 7 days a week. Look for the tent near the rear entrance of the hospital. Once again, to get tested, you need a doctor's order, a picture ID, and an insurance card if you have one. Patients who are tested must self-quarantine until your test results come back. Speaking of testing, public comments were made about the potential for Kauai to be the state's testing site for reopening to visitors. Here's what I have to say about that. Here at our EOC, we have a great team and a sound process. Every single decision that we make is with the guidance of our District Health Officer, Dr. Janet Berriman, and her staff, including Lauren Guest. Our process has proven to be effective and work just right for our island, and that's the way it should be. So everything that we do has a sound process backed up by a great team. We walk at our own pace, and we move when we feel that it's right to move. We march to the beat of our own drum. We will not be pushed to reopen prematurely if this team and myself does not feel that it is safe and it's the right thing to do. That being said, we do know that we eventually have to reopen and get the wheels of our economy turning. But like I said before, we do it in a safe, responsible, and staged process. We will take opinions from others, but at the end of the day, our process and our strategy is sound, and we stick to our strategy. Thank you. As a final note today, On last week's show, we discussed new protocols for obtaining a marriage license that needs to be clarified. If you're thinking of getting married during this crisis, the Department of Health advises that while you can arrange to get your marriage license entirely online, but the actual ceremony still needs to be performed with both the marriage officiant and the couple physically present. For the license, couples must apply online and prepay a fee at marriage.ehawaii.gov. Once the fee is paid and the application has been submitted, you can schedule an in-person or virtual appointment by calling 808-586-4543 or email doh.marriage@doh.hawaii.gov. Once again, Kauai, as we continue to make forward progress on our COVID-19 response, the following safety precautions will become increasingly important. Stay home as much as possible. Refrain from social gatherings or public outings. If you must interact with people outside of your home, keep a distance of 6 feet of separation and wear a mask. Do not leave home if you're sick unless you are seeking medical attention, and then only after calling your doctor first. Wash your hands frequently and clean surfaces often. We're going to get through this, Kauai. Stay informed and connected during this time of social distancing. We'll continue to post updates on our official County of Kauai Facebook page or on our Kauai Emergency Management Agency page at www.kauai.gov/COVID-19. The Centers for Disease Control is also updating its website regularly. For more information, please visit coronavirus.gov. Not everyone has internet access or follows the news, so please help to keep your loved ones informed. Kauai, we can do this. Hang in there and take care of one another. God bless and aloha.